When we consume animal products, that's where we get our vitamin B12 from. And so when we get our vitamin B12, it's attached to animal protein. And so A represents animal protein. Okay, and when vitamin B12 and the animal protein enter the stomach, we have stomach acids, HCl, as well as pepsin, that are going to come in and break down this complex in the stomach. And the reason why it breaks down this complex is so we get vitamin B12 by itself. Okay, so acid and pepsin, they come in and they're going to break down vitamin B12 and the animal protein complex. And so vitamin B12 is not by itself. Salivary glands produce something called the R protein. And so when vitamin B12 is by itself in the stomach, R protein is going to come in and bind to vitamin B12. And it is going to form a new complex, a vitamin B12 R protein complex. Now this complex is going to come and travel to the duodenum. And once it travels to the duodenum, we have pancreatic proteases that await this complex. And these pancreatic proteases, they're going to basically separate this complex once again. They're going to separate the vitamin B12 once again. So now vitamin B12 gets separated from the R protein by pancreatic proteases. And once the vitamin B12 is by itself, normally in the stomach, in the body of the stomach, we have parietal cells, and these parietal cells, they produce something called the intrinsic factor. Let's write this here. So IF stands for intrinsic factor. And when vitamin B12 is by itself, intrinsic factor is going to form a complex with vitamin B12. So now we have vitamin B12 intrinsic factor complex. And remember, intrinsic factor is crucial for the absorption of vitamin B12. And now vitamin B12 and intrinsic factor are going to travel to the terminal ileum, where vitamin B12 can finally be absorbed by the body. And so on step 1, questions that you will get on this information is what would happen if something is wrong with parietal cells, or what would happen if there's something wrong with the terminal ileum. And what happens is we will get vitamin B12 deficiency, because parietal cells, they produce intrinsic factor that is crucial for the absorption of vitamin B12. And remember, terminal ileum is the place where vitamin B12 is absorbed. So if we get dysfunction in either of those two places, we will get vitamin B12 deficiency. So this is a practice question on this information. A 36-year-old woman complains of fatigue and difficulty concentrating at work for the last 3 months. She has a history of Crohn's disease. She has been treated for acute exacerbations involving strictures in the past. Further evaluation of the patient will result in which of the following findings? So hemoglobin is 9.3, MCV is 120. So what this tells us is that this patient has macrocytic anemia, and macrocytic anemia is a hallmark finding for vitamin B12 deficiency. Okay, these lab values, they tell us that the patient most likely has vitamin B12 deficiency. Why? Because the patient has a history of Crohn's disease, and she has been treated for acute exacerbations involving strictures in the past. So what this tells us is that there could be something wrong with the terminal ileum that could result in a vitamin B12 deficiency. And what do we get when we have vitamin B12 deficiency? Well, it affects our spinal thalamic tracts. It affects our dorsal columns. It affects our spinocerebellar tracts. And so, because we get degeneration of dorsal columns, we would expect decreased vibration and sensation, which is answer choice B.